Sir, to start with, I'll be asking some of the common questions posed by our students. And first of all, this new CBME curriculum has come up, and now that your textbooks also changed as per the curriculum. So, according to you, what should be the approach or what should be the strategy of any third year or final year student as per the CBME curriculum for the university examination, sir?
CBME curriculum, I think the first batch will be appearing next year,
Yes, sir.
not this year. So this year, I think we will have the last batch of the old syllabus itself. Now, the CBME curriculum has changed into more of something which is demonstrable, objectivable things which are going to be there, and it's a continuous assessment possibly. And if you see, the curriculum has been reduced by almost 50% from what it was earlier. More than 50% of the theory topics are no longer there in the curriculum. The competencies which have been given by the NMC and the competency document, if you see the syllabus, it's reduced to less than 50% of what it was there. And there are very specific things that the candidate should know. And all those things have been very clearly defined by the NMC there. So the curriculum has become much more simpler. But the only thing that has been added is where there are skills which have been there. There are certain no skills which have been there, and demonstrable skills where they should have a log of log book which is to be maintained with particular skills that have been learned, etc. And that is one thing which is new, which was not there earlier possibly. And there is a lot of scope for communication and attitude and such things which have come into the syllabus, which is going to be addressed both in theory as well as in the practicals. So that is something which is totally new. Now, what has the curriculum changed? As I told, the curriculum has become very, very minimum compared to what medicine was. And the pattern of questions, what as the NMC is telling you about, that is you require to have all sorts of questions. So you should have a multiple choice question that should be there, which I think many universities already have. Long question, short notes, which are traditionally there. The marks allotment has been a little different there. The smaller subjects, which never were being given specific importance, like maybe pulmonology, psychiatry, dermatology, these have got 50 marks exclusive in one of the papers. So earlier they were just having around 12 to 16 marks in the entire 200 marks possibly. Now these small subjects have got a total 50 marks in the total paper that's there. In one of the papers it has to be covered so much. So they have to be known in detail. And also the individual subjects when they are taught, be it pulmonology, be it psychiatry, be it dermatology, individually in those subjects you should have the internal assessment, both as far as the attendance as well as the marks that has to be bought for clearing the or appearing for the final exams. So those subjects have been given a little more importance here. As far as the practicals is considered, I think most of the centers, the practical exams was in 100 marks. Now with the new syllabus, it's come to 200 marks. The practical for medicine is going to be 200 marks, and that includes the Viva also. So 200 marks. So the pattern also, they would want to have OSCEs, and I think most of the centers are going to train the students on that. So OSCEs is going to come up. The long case, short case will be there, but OSCE is one thing which is going to come up based on the new curriculum and more objective part of. But then again, it's more marks is almost double of what it was. So that is one major difference that is going to come, as well as the Viva, which was most of the time 20 marks. Now the Viva is going to be 40 marks in your exams. The clinical skills have to be the same, though the cases which are traditionally given, the old cases like we have the certain neurological cases which wish to be kept other than stroke and neuropathy, and maybe the cardiovascular system cases which we used to regularly keep, and some of the respiratory cases which we used to regularly keep, are not part of the curriculum for the theory, but for the practicals, I think they can be kept. And more of communication skills and the attitude part also will be assessed in the practicals as a OSCE. So one of the OSCEs is supposed to be communication skills. So those are new things which have come, possibly keeping in mind with the Western OSCE patterns, etc. Possibly the MRCP pattern, etc. has a lot of emphasis that is played on the communication part of it. So as for the exams, this is going to be the difference. As for the portions, as I told, the portions have been reduced to less than 50%. So studying is not difficult. Studying is much more easier in medicine now. So
I mean,
that is the main difference.
there is
That is
not much overlapping.
what has to be studied, it is very, very clearly described now.
Yes.
Earlier, possibly many of the universities did not have the curriculum properly written, like what are the subjects to be taught and what are the subheadings or what are the subtopics to be covered. But now the NMC document is very clear as what is the subject that is needed to be known, the must knows that are there. And those are very clearly spread. So syllabus is more clear now. And what is expected of a student also is very, very
I think, yeah.
audible now.
Yes, sir, we can hear you. And
I think there was some problem in the glitch.
Sir, yeah, now you are telling that it's clearly delineated. What are
the syllabus is very clear.
What is expected from the student?
Correct.
It's a clear-cut demarcation is there, and the portion is reduced to 50% mainly because there is no much overlapping now. Because earlier the same topic we were studying in the medicine, surgery, and many subjects, the same topic. Now that overlappings have been reduced, and the clear-cut demarcation
to certain extent, to certain extent, possibly the overlap has been reduced. But if you see the medicine syllabus, for some reason, I think quite a lot of important topics which we used to consider as undergraduate topics, maybe endocrinology topics and a certain amount of infectious disease topics, and some of the older, like if you see valvular heart disease, rheumatic heart disease, etc., which were taught to a very great extent, have been removed from the medicine syllabus. Even toxicology has been, major section of toxicology has been removed. So there are certain topics which possibly are important practically, but which you would encounter in your future, but the syllabus does not include it. And there is a large amount of emphasis which has been given to self-directed learning. Okay. So where there are no didactic lectures and the students are allowed to read on their own on these topics, possibly which we were taking more theory classes in the past. So as far as the theory part, I think it becomes easy, but maybe when you practice later, you would get a lot of cases which possibly theoretically have not been taught based on the CBME curriculum.
When you take up post-graduation, maybe you will be learning everything in depth.
Possibly that's what their aim is, to make a very competent medical graduate who is competent in skills and able to communicate. They may not have to know all the details. That's something which is maybe the aim of them.
Sir, what about the study? Like some people whether confused whether medicine has to be started in third year itself, or if it's okay if I start in final year and I come to fourth year MBBS, or when exactly to start preparing for medicine. It's a very vast and very very extensive, sir.
Yeah, agreed. As far as the earlier syllabus was there, I think medicine was started in the second year as a subject. Okay. But now I think medicine comes right from year one, first year itself. So there is something called as early clinical exposure, where they are exposed to certain medicine competencies, but not the theory part of it. Here it's very clear that we have to have exams at every year. Okay. Every year there has to be a particular exam in medicine and allied subjects, be it pulmonology or dermatology and psychiatry. And each of them should have their separate subjects and their separate papers have to be done. And then the final exams, final year, you will have 2 papers of that. So medicine has to be studied continuously, because there is nothing like medicine to be studied in the last year itself. As you know, in the CBME curriculum, a lot of subjects have gone up and down. You have some subjects which have come to the third year, some have been removed. The second year has been cut down grossly to 1 year rather than 1.5 years. So medicine has to be read continuously, but yes, emphasis on pure medicine may be the third year, and that's the second professional part, second professional, as well as the third professional part 1 and part 2. I think that is what is needed for the CBME curriculum, because it's a continuous process there, and there are a lot of skills that are to be studied. For that, medicine knowledge is needed right from the beginning.
Sir, now that I have read the medicine, your book for entire year, now only 1 month remaining for the examination exactly. What should be my approach for revision, sir? How should be I revising for
I think
better?
yeah, for the old batch, that is the non-CBME batch, which is I think appearing for exams. The pattern is very clear. I think you have long questions and you have short notes. So long questions which have a particular pattern where they ask the etiology, pathogenesis, etc. In some universities, they ask cases and you have to make the diagnosis. So I think quite a lot of universities do not have the case-based questions. They have traditional questions which are having 4 or 5 subheadings, and that's what is answered. Whereas short notes are very specific, maybe 3 marks or 4 marks or something like that, it is there. So the pattern for that, I think there is a syllabus which is split, paper 1 and paper 2. So you have certain systems which are coming in the paper 1, certain systems which are coming into the paper 2. I would like the students to understand that these are not hardcore, split.
Okay.
There could be questions which could come from either of the papers in either of the papers. So we should not be so much, very much strictly saying, no, this is a paper 2, so it should not come in paper 1. So overlap always happens. Now, what you have to understand is each of these topics, if you say each of these sections, be it cardiology, be it neurology, respiratory medicine, or endocrinology, to certain extent, infectious disease and HIV. These are the 5 sections from which we generally get the long questions from. So these are the questions like maybe from valvular heart disease or hypertensive heart disease in the cardiology sections, or maybe an arrhythmia that's coming. So these are the main questions that could be coming from these major systems. So these things you should be very clearly prepared. And generally the questions are repeated. It's not that something new will be asked.
Okay.
You should go through the old question banks. You would get the standard questions which have been there in the past. And one important thing that you have to understand when you read a question or when you read a subject, always make sure that you should read it in a form that you should be able to summarize it in various headings.
Okay.
You should be able to write an answer.
Frame it and answerable. Okay.
When you have maybe 4 or 5 pages of one particular topic, you should be able to summarize yourself to make sure that you would be able to write that answer in 20 minutes in a long question is asked. So always concentrate on basically the etiology of a particular thing, to a small extent on pathophysiology, but very, very important in medicine is the signs and symptoms of anything, any disease, the signs and symptoms. Always remember when they ask for clinical features, it means signs and symptoms. The marks have to be given for both signs as well as symptoms. And if they ask you management, please remember management means investigation as well as treatment. So there should be investigations written as well as treatment. So you should be any topic which you're reading, possibly a disease or a infection, you should have these 12 headings that should be there. And whenever you read it, you should be able to write or picture those things in those headings, and possibly you should be able to repeat the same thing in the exam. So generally, most of the topics, at least I would say, at least 80 to 90% of the topics are common topics which are asked again and again. So you could go through your question banks, or possibly whichever question, whichever book gives you, whichever book you're referring, they would be having certain way they represent the long questions or something like that. Question pattern would be there, my book or any other book. So whenever you read, you have to make sure that it is there. These are the must-know things that are there. So please remember, concentrate on these 5 topics which I have told, because large, if you say in each section, in each paper, you will have a significant portion of questions that are going to come from these sections. Now, that does not mean that you should not be concentrating on the others, because the short notes, short notes are there which are going to come from all the other sections. And there are sections like dermatology or psychiatry, which generally people do not read, but at least I believe in most of the universities, at least around 12 to 16 marks of questions come from that. And they also, there are very standard questions. Possibly if you see psychiatry, you should know about the drugs that they use in psychiatry. That's a common question. Schizophrenia, depression, and mania. These are some types of diseases which are asked in psychiatry. Alcohol abuse or alcohol dependence disorders. That is one more thing that you should know very well when you deal psychiatry. If dermatology, the common questions that would come is possibly from scabies, the skin infections that are there, psoriasis, and lichen planus. And to brief extent, you should know about the neurocutaneous syndromes. So most of the questions will come from these portions. So they are yielding topics, and especially in certain universities where MCQs are there, you do get a lot of questions from these skin and dermatology also. And at least 2 questions that may be around 8 to 10 marks are reserved for drugs. So drugs, maybe the traditional old drugs or the new drugs, okay, the anti-diabetic agents or the anti-hypertensive agents, or maybe an anticoagulant, or old drugs like anti-tubercular drugs, common drugs they are going to ask. One more thing that you have to remember is the medical emergencies. So these are sure shot questions, possibly a diabetic ketoacidosis, acute pulmonary edema, acute bronchial asthma management, anaphylaxis management, hypoglycemia management, or a GI bleed management, status epilepticus management. So you have around 12 to 13 emergencies which are there, which are sure short questions. Sometimes in a single paper, you would get 2-3 questions like this. And always when you read, make sure that you concentrate on these emergencies, because these are useful both in your theory as well as your practical vivas also. So always concentrate on such things rather than reading the entire topic again and again. When you read for the second time or the third time, please concentrate on these main points. Treatment, the drugs, and possibly the dosages. Certain things that are must, like possibly the treatment of malaria, treatment of tuberculosis, treatment of enteric fever, treatment of all these emergencies which I have told you, anti-diabetic drugs, such things you should be knowing thoroughly, and they will be asked as possible. And certain things off late they're asking is about the investigations, possibly maybe in a patient with acute MI, what are the investigations that you would ask? A patient with a acute pulmonary embolism, what are the investigations that you would ask? Or maybe a patient with the HIV, what are the investigations that you would ask? A patient who's been a diabetic, what are the things that you're going to do when the patient comes for a follow-up? So these things you have to concentrate on when you're concentrating on your theory reading. And the same thing has to be done when you write the theory paper also. So I think very important, the most important, I think every of your subject, this is important, is to time your theory paper. So generally you have 3 hours of your paper that's given, and make sure that your long question does not cross more than 20 minutes.
20 minutes.
So 20 minutes is maximum for 10 marks, not more than 20 minutes. So 20 minutes is the maximum that you're going to write for the long question. Whether you write it in the beginning or write it in the end does not matter. 20 minutes is the maximum for a 10-mark question that you're going to write. Do not cross that 20 minutes, because if you cross it, all of your other questions are going to be, questions are going to suffer. So 20 minutes is the time for your long questions, and short notes possibly based on the marks. If it is a 4-mark question, possibly you can spend around 5 to 6 minutes. If it is a 3-mark question, it should be 4 minutes. And you have to attempt all the questions. So there is no question of not attempting. Some questions you may not know, but make sure you can keep it at the end and think about it and possibly write something there. Don't write totally opposite things. Don't write totally maybe nonsense, unrelated things, but still attempting all questions is important. Sometimes for the attempt, they may give you some 0.5 marks or something. So don't leave any questions. Try to attempt all in a sequence if possible. Not necessary. You can write it up and down, provided you start each question in a separate sheet with the proper number and the proper title of the question. You can attempt questions in any sequence. The other most important thing I would want all of you to very, very importantly remember is to read the question paper.
Okay.
The moment you get the question paper, please read the question paper at least 2 or 3 times. That is the first 6 to 10 minutes. Do not start answering. Just read the question paper thoroughly. There are so many times we get the question paper and we start answering, and then we read something else and we write something else. So there are so many times I think they've asked for electrocardiographic findings of something, that is ECG findings of something, and people have read it as echocardiography findings. Electroencephalography has been read as echocardiography. It's very, very common to make that unless you read it. So make sure 5 to 10 minutes you read each question properly, read all the subheadings. Because if a question has a 10 marks and there is a split of clinical features, diagnosis and management, each of them have separate marks. If you do not answer one portion of it, you will lose that much marks. So make sure you read all the subcomponents and decide the order what you're going to write, and then start writing. And once you start writing, please concentrate on the time. Long questions, not more than 20. Short answers, not more than 6 minutes. And make sure you at least have 15 minutes that is remaining at the end for going through the questions again. So that's how you attempt a paper. And please remember, management, if it is asked, it means investigations and treatment. That is, and again, if the clinical features are asked, that means it is signs and symptoms. Symptoms and signs. So you have to write the symptoms as well as the signs. This is a very common question. They'll ask you in medicine management. So it means investigations and treatment. So that is something that you have to concentrate on, I think, about the theory. Yes, Kishan, anything else?
Sir, yes, many of my questions are already answered, like important topics, what are to be covered, and how to appear, like how to be presenting ourselves in examination, everything. Sir, you have been a seasoned examiner for more than a decade now. So you have seen all type of students, UGs, PGs, DNB, everything. So what are the common mistakes done by students and which you don't expect to be done? Okay, you think, if you really feel like, oh my God, these kind of blunders should not be done.
Okay, maybe if we're talking about theory as well as practicals, I think. So theory, the first thing and most important thing is sometimes we know a very topic very, very well, and it comes for a short notes, but we have read it so well that we can write everything about it. So you tend to write everything about it. So you should remember, always think the marks, what you're going to get. So if it's a short notes, if you write everything also, you're going to get only 4 marks. You're not going to get more than that. So do not waste time just because you know about it. Do not write. Supposedly they have asked management of, say, pulmonary embolism. There is no use of writing the clinical features just because you have known about it. Please be specific in writing the answer. If a diagnosis is asked, please mention the diagnosis and justify why are you saying this is the diagnosis. If management is asked, please write the investigations and do not just write ECG, X-ray, CBC, LFT, RFT. You have to write what you expect. Supposedly it's a pulmonary edema. X-ray will show cardiomegaly with bat wing appearance. Cardiac enzymes might be elevated. So you'll have to write that. Just writing ECG, X-ray, echo and all will not give you the marks. So specific investigations as well as the maybe non-specific investigation. So people generally tend to write everything for everything, all investigations for everything. And generally the questions which they do not know, they have a tendency of writing it absolutely at the end. So they keep on writing pages together about all the subjects they know. And then when the questions come which they do not know, they just write 1 or 2 lines, you know, and that's very evident for us that they don't know it. Right. So I would say that please don't keep such questions exactly at the end. Put it just somewhere in before. You don't keep. The last questions also should be good answers. Last answers which you write also should be good. Somewhere just prior to that, maybe you can write a short. Maybe the marks may be a little more there, because if you write all these questions which you do not know at the end and you just write 1 line and all, which is completely wrong, you may not get any marks. So do not make a attempt. Like the last answer also should be a good answer. Something which you know very well, make sure that you end it with that. That's about the theory writing. Handwriting, legible, how clearly they can write. Now it's very difficult. I think majority of the students do not have such a great handwriting. And many of the universities, including ours, where they write on iPad. So the handwriting is quite a difficult part of it. So it's better to write, if some things are important, please write it in capitals. If you are able to write flowcharts, that would be wonderful. If you are able to put it in points, that would be very good. Rather than writing sentences, these are the 3 things that could help. So either write in capitals, the main important, don't write the entire answer in capitals. The main important, possibly the drug of choice or the investigation of choice, please write it in capitals. please write it in points. And the best way to write is flowcharts. Flowcharts, if you're writing, that means your understanding of the subject is perfect. Nobody can write a flowchart if your understanding is not good. So if there is one or two flowcharts that you've written in your paper, that gives a very good impression to the examiner that you are studied the subject very well. So that is very important. So these are three things which get the additional point. Other than the handwriting, somebody has a beautiful handwriting, generally it gives a very good opinion about it, and then they generally get a little more marks for that. When you come on to the practicals, the most important thing I think which is totally understated is how you come to the exam hall. Okay. You know, 90% or above of the students come as if they are going to undergo a surgery. They come nil per oral. That is something which is, how much ever time we emphasize, how much ever time we say that, correct, it might be your mental status might be like that, that as if you're going for something, but then your physical as well as your mental status should be appropriate. We have seen wonderful students crumble in the exam just because of hypoglycemia. They are just silent. Hypoglycemia is the most lethal thing that can happen to you in your exams, much more lethal than your external examiner and internal examiner. So please eat something or at least drink something which is having glucose. Hypoglycemia has caused catastrophe in the exam. Good students have just passed just because of hypoglycemia, nothing other than hypoglycemia. Everything they know, everything they have studied, and on that day they are not able to answer just because they go blank. So please remember that you should drink a juice or something, or carry some chocolates and juice or something like that. That is available in most of the exam halls. They do provide you also. So make sure you eat. That is very, very important. Sleeping is necessary, but I think we have all gone through that. The adrenaline surge that is there around the exam, it might be difficult to sleep, but do not sleep at all. So at least have a good sleep. But more important is, do not let hypoglycemia be the killer for you in the exam. Eat and come. I'm not saying eat everything and come and all. Eat so that you don't land up in hypoglycemia. All your performance in the exam is secondary. All your how much ever knowledge you have, how much ever presentation you do, and how do you answer, all those is secondary. You have to be physically and mentally able to take the exam, and that comes only by making yourself prepared. Prior to the exams, whenever the practical exams, be very careful in what you eat prior to that. Make sure your health is maintained. Do not be adventurous and try to do things prior to the exam. At least a lot of diseases are there in the periphery, a lot of respiratory infections, etc. are there. So make sure you don't travel too much. Make sure you eat proper food and get adequate sleep. I'm not saying you have to sleep 8 hours and all those things. That is not possible. Exams, the stress, you will not be able to sleep. But make sure at least on the exam day, you eat something and come. Do not come without eating anything, because that is the most detrimental thing that you can do to yourself. As far as the answering of the things, case sheet writing, majority of the students have a habit of taking the case, examining, and then starting writing. So that is where they lose a lot of time. So very important moment, you start speaking to the patient, taking the history, start doing the examination, checking the blood pressure, checking the pulse, checking certain of the vital signs parallelly. Speak and do it parallelly, and do it together. And once you finish everything, then start writing. Many of them do it half and then again go and then miss something and again come and check it and all those things. Do not waste much of time. Majority of the times you would know about the case prior to the exam itself. You would know what is the possible case and what is the history, etc. would have been told to you by the experts possibly. So you would know the diagnosis. It's nothing that it will come eureka on the spot. You would already know it. So it's nothing to get too much worried about. But make sure you examine the patient. And many a times the clues would have been given so much that they would not examine the patient in the exam hall and write a full case sheet. Please remember, the examiners are watching you. So make sure you do an attempt to examine the patient. Okay, the blood pressure checking, the neurological examination, checking the reflexes, etc. You have to do it. though they may not ask you to demonstrate later, but they are observing what you're doing with the patient. So make sure you do that and write a proper case sheet, a clean case sheet. Do not use short forms. I think all that rules are there. Do not use short forms. Write legibly and write all systems in a long case. So the major system which is given to you has to be written in full. All of the systems also have to be written at least in certain points. Write the summary and write the diagnosis. And if time permits, you can write what possible investigations you want to do. Very clear, when the examiner asks you to present a case, please start presenting it properly. Sometimes they would ask straight away diagnosis and then retrospectively go. So be prepared for such systems also. And if you do not know an answer for a question, please be very soft and tell them that you do not know. Okay? Just don't keep quiet and stay there. Examiner also will wait for that, and then time is wasted. You know, long case, maybe you can get 7 to 10 minutes, maybe. Sometimes maybe 15 minutes is given for presentation, usually 10 minutes itself. In that 10 minutes, how many questions you answer is what your marks is going to be. If you keep quiet and just wait for, make the examiner wait, then the number of questions you're going to be answered is less. So if you do not know something, politely say that you do not know. They would generally change the question. Most of them would change the question, and maybe you'll be able to answer. Very, very important is your clinical demonstration skills, because if you do it wrong, then there is nothing like coming back. Especially eliciting the reflexes, eliciting the plantar, checking the blood pressure. If you do not know to check the blood pressure, it is lethal. They are not going to pass you. If you do not know, if they ask you to check the blood pressure, that means they are deciding to pass you or fail you. So be very careful in that point. And always, whenever you are asked to demonstrate, take the permission of the patient and then do it. And think before you do the things. You just don't jump and do things, and do it very specifically, and then tell your interpretations. And if by chance you're not done something and the examiner asks, please tell them that you're not done. They might give you a chance to do it. So always think and answer. Answer common things. Don't tell rare things. Don't tell rare syndromes. Many of the examiners themselves would not know it, so they may get offended with that. So make sure you answer simple things and answer confidently. And again, the same thing for the vivas also. Whenever the viva is given an X-ray, ECG or an instrument, make sure you identify it properly and tell the salient features. And if you do not know, possibly tell them that you do not know, so that they change the question. So that's the general thing that would give. But I think it's uniform for all the subjects, not only for medicine. But the most important thing I want to emphasize is, it is not a surgery or endoscopy you're undergoing. Do not come nil per oral.
Sir, and one of the common doubt what undergraduates have is, should they know detailed ECG interpretation and these dosages of these all the drugs? Is it mandatory to know?
Yeah, with the new CBME curriculum, I think ECG has been brought to a straight. ECG is going to be a demonstrable skill, and in the OSCE, in the final exams, ECG is going to be asked to done in the CBME curriculum, because that's a skill which has to be done. Okay, done 3 times, 5 times, and then you should be knowing. New CBME curriculum, ECG is a must there. Old curriculum, yes, you should know to do the basic things in ECG, possibly calculation of the heart rate, check the rhythm, whether it's regular or not. You should know to identify the changes of MI, the ST elevations, and hyperkalemia changes. These are things that you have to know. And some arrhythmias, possibly like atrial fibrillation and ventricular tachycardia. These things you should be able to identify. So that is what is expected of ECG from the undergraduate, even in the old as well as the new curriculum. But new curriculum, ECG taking, you have to demonstrate how do you place the ECGs and how do you take a print of the ECG. That is a certifiable skill and possibly an OSCE station in the new curriculum. But old curriculum, you have to know about ECG. And a lot of questions are asked in theory as well as MCQs on ECG. So ECG is and many of the universities, ECG is one of the viva stations. So some of the ECGs you should know. And calculation of rate, rhythm, and if possible, you know about the axis. Those 3 things you should be knowing as basic. Drugs, as you said, drugs and dosages. Emergency drugs, you have to know. Emergency drugs with dosages, you should know. If supposedly, if you want to give a patient hydrocortisone or adrenaline, you have to know. You have to know the dosage. What is the route of administration? You should know. So emergency drugs, you are expected to know the dosage. Common antibiotics, you should know the dosage. Antihypertensives, anti-epileptics, anti-diabetics. Common ones, you're expected to know the dosages. More important, what you were expected to know about a drug is that you should know the common adverse drug reactions. You should know what the drugs can cause. Anti-tubercular drugs, the hepatitis, the anti-epileptic drugs, what are the toxicities it can cause. You should know about the adverse drug reactions of all these common drugs. Again, remember drugs, medicine is, each disease has drugs, each disease has its own drugs. So there is no limit of knowing what the which drug can be asked and which drug cannot be asked. So generally the common drugs are only asked. Very rarely, unless you answer everything properly or you lead the examiner to something rare, only then the rare drugs are going to be asked. Yes, anything else?
Sir, some of our students feel it very difficult to differentiate or to identify the murmurs in a CVS case. And some of the students also find it very difficult to localize the facial nerve, pulse, whether it is UMN or LMN. So what is the solution?
Yeah, facial nerve, I think it is not at all difficult. Facial nerve, UMN, LMN, I think is absolutely, the upper part is spared, upper part is involved. So if the upper part is involved, the wrinkling and all is not there, that means it's a LMN facial palsy. If the upper part is spared, that means it's a UMN facial palsy. So facial palsy, it's not going to be difficult at all. Yes, murmurs is something which is, it cannot be, what you hear, what I hear is different. I can't interpret how your, what frequencies you hear and all those things. But again, remember the most important thing in cardiology, I think we have discussed this in the case discussions when we did it earlier, that auscultation is a very, very, very small part of your cardiac examination. You should be able to make the diagnosis with the pulse, the blood pressure, the JVP, and maybe the apical impulse. So by the inspection and palpation itself, you should have an idea what this patient is having. And after that, you have to know what disease can be causing what murmur. See, many a times you would know already, the case would have been given to you that this is a mitral regurgitation case or aortic stenosis case. So, but you have to know what mitral regurgitation murmur is. Na? If despite of knowing that this is an MR case, you come and tell that's a mid-diastolic murmur, that would be wrong. So your theoretical knowledge of what murmur is present in what disease is what you have to know predetermined. So if you know that, possibly you will be able to hear things better. But actually it is not the way. You're supposed to auscultate, identify the murmur, and then identify the disease. But possibly to a certain extent, maybe none. I'm not saying that it is the right thing to not know the murmurs or not identify the murmurs. Many of the valvular heart diseases are not so common. We do not get it. And many a times in the exams, you do not keep the classical rheumatic valvular heart disease. You might just be kept a aortic stenosis. That's the only murmur you might be able to hear. Or an anemia with hemic murmur might be heard. All your classical valvular heart diseases become lesser and lesser now. So you may not get it in your regular bedside, and on the exam day, they will get some classical exam cases. So what you have to know is your basic knowledge of the disease. Aortic regurgitation is early diastolic murmur. Aortic regurgitation can be identified by the pulse. You don't require to do auscultate a patient. So you have to have a very comprehensive cardiac examination, which will give you the diagnosis even without auscultation. Okay? So auscultation is a very, very, very small portion of cardiovascular diagnosis. So I agree, complications, everybody is worried about murmurs, but it is not about murmurs. It is where is the apical impulse? How is the character of the apical impulse? How do you look for parasternal heave? Are there pulsations in the pulmonary area? Are you able to palpate the P2? All those things will give you the diagnosis rather than auscultation. But since the exams is coming closer, I think you should know the murmurs by heart. There is nothing short of that that could be there.
Sir, how much?
And I think you get a lot of videos which can simulate the murmurs, but they are nothing close to what you can get it really.
At least if they can at the undergraduate level, they should be able to tell whether it's a systolic murmur or diastolic.
Yeah, that much is enough. That much is enough. That much is enough.
Early systolic, late, all those things.
Yeah, all those things are not needed. I think that's what. If a patient has a irregular pulse. Pulse is irregularly regular. That means it is atrial fibrillation, and atrial fibrillation is seen in mitral valve disease.
Okay.
So either it is mitral stenosis or mitral regurgitation, right? And if you have a low blood pressure, blood pressure is low and there is irregularly regular pulse, it is mitral stenosis. If it is irregularly regular and a wide pulse pressure, the pulse pressure is high, blood pressure is little on the higher side there, then it is mitral regurgitation you're looking for, isn't it? If the pulse is regular, then we are talking about aortic valve disease, aortic stenosis or aortic regurgitation. Aortic stenosis will be a very low volume, aortic regurgitation will be a bounding pulse. So it's not difficult to make out. Okay, medicine, especially cardiology, you will have a set sort of things. It will all fall in place, provided you know that it is like that. And it's easy for us to say, but possibly maybe when we were,
when he has to read all the subjects,
it is difficult. But yeah, if possibly you've seen a case earlier, I think you would be able to make out. At least systolic, diastolic, you should be able to say. And the theoretical causes of pansystolic murmur, causes of mid-diastolic murmur, that's all theory. You have to be knowing it by heart.
And how much are you read for a year together or a last month revision, everything? What really matters is the previous night, whatever you study, sir. What you really remember.
No, that is the real thing. I think previous night studying is generally you would studying because what case has been discussed yesterday, the same case will be kept tomorrow. So you would call up your friends and ask what are the questions the examiner asked. And generally you tend to, recollect the same things and all. But when you go there, possibly the examiner would totally change the questions because you would know that what he has asked yesterday, if you answer the questions correct, then you know that you have found it out that way. I do agree that previous night you have to be aware of things, what is happening, but do not totally depend on that. You require to have, last night before the exam, I think you should try to relax and read the basic things, rather than about the case related, about what are the causes of clubbing, what are the causes of edema, and how to demonstrate. All those things you should be knowing properly, possibly prior.
No, I'm asking about theory, sir. Theory also. Say,
theory, I think, definitely.
For theory, I think revise the entire book on the previous night to able to go through the how to make it possible to go through the entire syllabus on previous night.
Yeah, possibly. I think as I told you, the important topics which have been general long questions that are going to be asked, and in each system there are a set of long questions that are going to be asked. Like I told you, emergencies are there, management of certain things are there. There are tables that are given. There are color-coded images, be it Davidson or even any book. The management is given in a color format, so you can just concentrate on that. And there are certain lists that are there, possibly causes of clubbing or causes of cyanosis. Such list has to be possibly revised on the day prior, rather than reading the full topic. And please don't keep any topic pending for the last day.
Yeah.
It is not going to help. If you kept it pending, let it remain pending. Does not matter whether you read it on the last moment and then next day you get it. That will be an extreme amount of luck. Any other questions?
Yeah, questions are so many, sir, but only relevant things which will be applicable for all the students. I'm just posing to you. Only most common, more than question, they're thanking you. That most of them are of the opinion that for their, especially so many postgraduates are messaging Dr. Balram, Dr. Anil Vyas. We could pass the general medicine just because of your videos and your books, sir. Okay. Postgraduates after completing, they're giving all the credits to you, and some people are having dilemma in taking up medicine as a career branch, whether to go for general medicine, which further requires DM or super specialty, or to take some end branch like pulmo or this thing. So all those are different set of questions altogether. We will have it a different session. Today's it's particularly for exam preparation for undergraduates. And any other doubts, any topic wise? See, he's the author, his authority, one who is authority in medicine can publish a book. Okay, so you can, any dilemmas you have, okay, if you are not understood a concept clearly, it's differently given here and there, so you can directly ask sir and make it get it cleared. Okay. Uh, Final 2-3 minutes. If you have any doubts, please ask us directly. Aditya is repeatedly asking about the OSCE. Sirs, already OSCE videos are available in our channel. Okay, please go through them. All the videos which are possibly required for medicine already available in our channel. Sir has in detail has done. Please go through them. Even then, if you have any questions, you can ask.
OSCE, I think for undergraduate is in very, very few centers keep it. And the general OSCEs that are being kept is usually a clinical sign. Maybe demonstration of pedal edema or demonstration of a knee jerk or a plantar reflex. And possibly the other OSCE that has been kept is only spotters. OSCE has been changed into spotters, where they keep a X-ray or a image or a clinical image or a skin lesion, something like that. So that's the OSCE which is in practice now. The two OSCEs are not done in any universities as of now, but eventually for the CBME curriculum, the true OSCEs will come where there are stations with checklist. Okay, when you demonstrate certain things, there are checklists that are there. And I think possibly very soon I will be getting a book on OSCEs, possibly where we will cover on those things and the checklist regarding various common things that will be asked, both for undergraduate as well as eventually I think the CBME curriculum is coming for postgraduates also, and for maybe exams elsewhere. OSCE is very much in vogue in the USMLE, the MRCP, such things are there where OSCE is an important thing. I think there are checklists which are needed for individual demonstrations. I think it's not on the realm of this class, but maybe we can discuss it sometime.
One of the most studious medico is asking, sir, any suggestions to improve presentation in theory exams? Sir has already explained in detail what should be, how should be the presentation, how you should write, everything.
So very important in theory is please read the question properly. Do not miss a sub question. Some sub question will have a 2 marks or a 3 marks, and you don't write it, you will not get the marks. Please read the question paper for 5-6 minutes, 2 times, 3 times. Make sure you know the order, how you are going to write and what you are going to write. And please write what is expected. Do not write extra. And time, long question, 20 minutes maximum. Short notes is only 5 to 6 minutes, not more than that.
Sir, at the end, to conclude, as a very kind teacher, very student friendly and most favorite teacher of all the students, what's your kind advice to all your beloved students and White Army members for the examination, sir? Finally.
So I think that's what everybody is in the medicine, and the final year exams are the most crucial they consider, but I think you have all cleared your other exams. So the final year exams also will be as easy as what it was for your other years. It's easy to be done. Once you finish your exams, maybe you'll also say the same thing. But till then, possibly you have to keep a positive attitude. You have to make sure that you are prepared well prior to the exam, as well as on the day of the exams. You have to be, as I said, your mental status as well as the physical status should be appropriate. So you should have some food, dress up properly, dress up cleanly, and get all your instruments, etc., and carry yourself properly and come to the exams. And nothing is difficult. All what you know only will be asked. Nothing that you do not know will be asked there, and everything will be fine. So you just have to keep yourself fit enough to be presenting on the exam. That's all. Everything else will be fine. So both for the theory as well as the practicals, please make sure that prior to the exams, you take care of your health. Make sure that you do not get into all these communicable diseases which are there around. So you have to be very careful and cautious about what you eat and where do you go, all those things, and be a little serious and focused on the particular subjects, and all of you will do it. So,
sir, Mr. Sogat is asking you, is there any particular standard range for normal vowel sounds? Archit sir, can you hear me? I think.
Yeah, Kishan, you said something I couldn't hear.
Yeah, Mr. Sogat is asking you, sir, is there any standard range for a normal vowel sounds? What's the frequency?
Normal vowel sounds is 6 to 32. That's what is given. So anything more than that, 6 to
vowel sounds
32
per minute. Okay.
per minute, 6 to 32.
And asking another student asking what all to cover for a CNS case.
So CNS most important case that is kept for you is stroke. So you have to know about the stroke, the site of lesion, the localization of it. I think the good video is there already on White Army. You can go through that. Other neurological diseases which are asked are neuropathy. Sometimes GB syndrome is kept. Sometimes Bell's palsy may be kept. So these are the common diseases that are kept. Parkinson's can be kept. Motor system examination, cerebellar system examinations can be kept. And most often you will be asked to demonstrate the clinical signs, the reflexes, the examination of the cranial nerves, the examination of power, the examination of tone, demonstration of cerebellar signs, demonstration of gait, such things will be asked.
So if you have any other doubts, please post it in our YouTube chat section. Okay, I'll forward it to our beloved mentor and get it answered for you at his convenience.